Assalamu alaikum. Beta, in this video lecture, I will deliver the endocervical polyps. Okay, it's a small topic, easy to understand. In the previous part of the cervix pathology, I delivered you a little about the anatomy of the cervix and some inflammatory process of the cervix. Okay, now it's time for the endocervical polyps. Beta, you know that cervix has got two parts. Here you can see this nice little part that is present in the vagina. This is called ectocervix. Okay, and this is the external os which is connecting this ectocervix to above part of the cervix, and this is the endocervix. Okay, so this from here till here is the endocervix, and from here below is the ectocervix that is present in the vagina. Okay, now what is the endocervical polyp? Endocervical polyp is the common benign exophytic growth. Exophytic growths, that means that it is coming out of the endocervical mucosa. This is exophytic, coming out into the lumen, and it is benign. That means it is completely localized to place from where it originated. Okay, it does not have metastatic potential. It arises within the endocervical canal, not in the ectocervix. Okay, endocervix के अंदर ये ग्रो होता है बेटा. और इसका जो साइज़ है, इट कैन वेरी फ्रॉम very small sessile bumps to large polypoid mass that may protrude through the cervical os. तो कहने का मकसद ये है कि बेटा ये बहुत छोटे से छोटा एक सिजाइल बम्प भी हो सकता है छोटा सा, या फिर ये बहुत बड़ा लार्ज पोलीपॉइड मैस भी हो सकता है. इट कैन बी लाइक दिस. इफ दिस इज द एंडोसर्विकल मिकोजा, इट कैन बी, लुक, दिस इज द एंडोसर्विकल मिकोजा, इट कैन बी लाइक दिस स्मॉल bump. Okay, or it can be very large polypoid mass. Okay, एंड इन सम केसेस व्हाट हैपन्स कि ये इतना बड़ा होता है पॉलिप के, ये जहाँ पे जो एक्सटर्नल ओस होता है इसके थ्रू बाहर आता है और एक्टोसर्विक्स में दिखाई देता है बेटा. ठीक है, समटाइम्स इट इज़ एज मच लार्जर दैट इट कैन कम आउट ऑफ दिस एक्सटर्नल ओस एंड कैन बी विजुअलाइज फ्रॉम बिलो. ओके, राइट. If we talk about the histology of this polyp, that means if we take this polyp out and you see this polyp under the microscope, you will see that this is composed of loose fibromatous stroma covered by the mucus secreting endocervical glands. You understand? If you see this polyp under the microscope, you will see there is the stroma present. This stroma is the loose stroma and it is fibromyxomatous stroma. That means it has the fibrous and the myxomatous component. Okay, and this stroma is surrounded by mucus secreting glands of endocervix. Okay, so this is the fibromyxomatous stroma and is surrounded by the glands, mucus secreting glands, right? Look, loose fibromyxomatous stroma, and it is covered by the mucus secreting endocervical glands, which may show inflammation as well, right? Okay, endocervical polyps, they may be a source of the irregular vaginal spotting or bleeding. If your cervix has a polyps, depending on the size, if it is very much large, it will obviously come up with the bleeding. But if it is small in size, obviously it will cause a vaginal spotting, right? Bloody spots from vagina. What is the treatment option for endocervical polyps? It's very simple. आप क्यूरेटाज जो स्पून शेप एक काइंड ऑफ इंस्ट्रूमेंट होता है जिसके थ्रू आप इसको रिमूव करते हो, या जनरल सर्जरी में, ऑन्कोलॉजी में आप सर्जिकल एक्सिजन करते हो इस पॉलिप की. ठीक है बेटा, दैट्स ऑल अबाउट endocervical polyps. I hope you got the concepts. Thank you so much beta. Class dismissed.